Today, I want to talk about an important health signal that many middle-aged and older men experience. As we age, various changes occur in our bodies. Among these changes, there are specific signals that we need to pay close attention to. Based on my 40 years of clinical experience, many symptoms that people dismiss as simply due to aging are often clear. Warning signs that a prostate problem is developing. When you wake up in the morning, do you notice that your erections are not as firm as they used to be? Or when you go to the bathroom, does your urine stream feel weak and intermittent? Also, some of you might feel like you haven't completely emptied your bladder after urinating, or you might wake up frequently during the night to urinate. These symptoms are definitely not something to ignore, as just a part of getting older. The prostate gland naturally increases in size as men age, but the rate and extent of this change can vary greatly, depending on lifestyle and management methods. What I have confirmed through over 10,000 patients who have visited my clinic is that those who started appropriate management early maintain healthy urinary function even in their 80s and 90s. On the other hand, those who neglected the initial symptoms often suffered from severe urinary disorders and decreased sexual function from their 60s. Gentlemen, if you experience these early symptoms, it's an important signal your body is sending. Ignoring this signal can eventually lead to benign prostatic, hyperplasia BPH, or, in severe cases, even prostate cancer. As the symptoms worsen, you will feel pain every time you urinate and have to wake up 3 or 4 times a night to go to the bathroom, leading to a painful situation. Furthermore, it severely affects your sex life, causing marital problems and significantly lowering your quality of life. In this video today, I will explain in detail how to understand and manage these signals. Based on my experience and medical research, I will introduce the most effective management methods for you. I will explain how the prostate problem signals I mentioned earlier actually manifest through the case of one of my long-term patients. This patient worked in construction for 40 years and lived a life as robust as an Iron Man. When he first came to see me, his prostate problem was already quite advanced. I still vividly remember his shyly telling me that it was the first time in his life he had ever visited a hospital. The gentleman's symptoms showed the typical progression of benign prostatic hyperplasia. He said that at first he had to strain to urinate when he went to the bathroom in the morning, and gradually he started urinating more frequently during the day as well. Then, after retiring and passing the age of 70, the problem worsened rapidly. What he found particularly difficult was having to wake up 3 or 4 times a night. Someone who had slept through the night his entire life was now in a situation where he woke up every 2 hours because of his bladder. In this patient's case, the changes in his social life due to urinary problems were particularly noticeable. He had gone hiking with his neighborhood friends every morning his whole life, but he had to give it up because there were no restrooms on the mountain. After wetting his pants at his grandson's first birthday party because he couldn't find a bathroom in time, he stopped attending family gatherings as well. He gradually stayed home more and more, and over time, his depression deepened. There were also significant changes in his marital life. He had always had a good relationship with his wife, but as sexual intercourse became impossible, a psychological distance grew between them. He even felt uncomfortable when his wife entered the room and was consumed by feelings of self-reproach for not being able to fulfill his role as a husband. This kind of psychological distress is a typical pattern I have witnessed countless times in my 40 years of practice. Prostate problems go beyond simple physical symptoms and significantly impact quality of life and self-esteem. What are the fundamental causes of these symptoms? Now, let's medically examine the reality of benign prostatic hyperplasia and its various causes. Benign prostatic hyperplasia is a clear medical condition that cannot simply be dismissed as a consequence of aging. The prostate gland is a unique organ found only in men, and in its normal state, it is about the size of a chestnut, weighing around 20 grams. It is located just below the bladder and surrounds the urethra. This positional characteristic is the core reason why benign prostatic hyperplasia causes urinary problems. What I have focused on in my 40 years of clinical experience are the various causes and risk factors of benign prostatic hyperplasia. While most doctors simply explain age and hormonal changes as the cause, in reality, more complex factors are at play. Firstly, the influence of dihydrotestosterone, a male hormone, plays a role. As men age, the rate at which testosterone converts to DHT increases, and this DHT promotes the proliferation of prostate cells. Secondly, chronic inflammation exacerbates prostate enlargement, especially if semen is not regularly ejaculated for a long period, leading to inflammatory changes in the prostate ducts. Thirdly, lifestyle factors are involved. Analyzing my patient data, I found that benign prostatic hyperplasia was more severe in those with excessive alcohol consumption, spicy food intake, excessive caffeine intake, and sedentary lifestyles involving prolonged sitting. Fourthly, genetic factors are also important. A family history of prostate enlargement increases the risk of developing the condition by about 4 times. These factors work in combination to cause the gradual proliferation of prostate tissue, which eventually compresses the urethra. This is the direct reason why it becomes difficult to urinate, why the flow is not smooth, and why there is a feeling of residual urine. A clinically important fact is that if benign prostatic hyperplasia is left untreated, it can lead to serious complications beyond simple discomfort. These can include urinary tract infections, bladder stones, kidney dysfunction, and even acute urinary retention. Considering the various causes and complications of benign prostatic hyperplasia, I've explained the main concern for many patients is the treatment method. The standard treatments for benign prostatic hyperplasia are medication and surgery. Medications, primarily alpha blockers and 5-alpha reductase inhibitors, are used. And while they can be effective, they often need to be taken lifelong and can have side effects such as dizziness and decreased sexual function. Surgical treatment typically involves transurethral resection of the prostate TURP, a method where an endoscope is inserted through the urethra to remove the enlarged prostate tissue. Patients face a difficult decision when presented with these options. They worry about the long-term side effects of medication, and they hesitate about surgery, thinking it might be risky at their age. Therefore, I want to share a method that, while not actively recommended by all doctors, is medically proven. That method is the regular release of prostatic fluid. This approach is simple yet effective, but it's a topic that many doctors don't openly discuss with their patients. What I have confirmed through 40 years of clinical experience is that the stagnation of prostatic fluid has a much greater negative impact on prostate health than most people realize. The prostate is an important gland that produces about 30% of semen. In a healthy state, this secretion should be regularly released. However, as men age, the frequency of intercourse naturally decreases, and the opportunity for semen ejaculation significantly reduces, especially in cases of spousal loss or divorce. Recent research supports the importance of semen ejaculation. A 2023 study published by researchers at Imperial College London in the UK found that if prostatic fluid is not ejaculated for a long period, microcrystals can form inside the prostate ducts, which can trigger chronic inflammation and promote the enlargement of prostate tissue. Analyzing one set of clinical data, patients who ejaculated semen more than 8 times a month had an average prostate size that was 23%. Smaller and significantly lower urinary symptom scores compared to those who ejaculated less frequently. This is strong evidence that semen ejaculation directly affects prostate health. The important point is that this semen ejaculation does not necessarily have to occur through intercourse. Ejaculation through self-stimulation has the same medical effect. The World Health Organization (WHO) also recognizes self-stimulation as a normal and healthy sexual behavior in adults. Many older men are unaware of this fact, or even if they are, they feel shame or guilt due to cultural or religious reasons. One 80-year-old patient I met in my practice asked me, "Doctor, is it okay for someone my age to do such a thing?" I explained that it is not a shameful act, but rather a medical management method for prostate health. Gentlemen, regular ejaculation of prostatic fluid is essential for a healthy prostate. This is a medical fact and a method I confidently recommend for the health of my patients. I have explained how important the regular release of prostatic fluid is. However, there is an even more effective method than simple ejaculation. I would like to introduce the prostate circulation therapy that I have developed through my 40 years of clinical experience. This method is far more effective for prostate health than general self-stimulation. First, I want to emphasize that this approach is based on medical principles, different from simple self-stimulation. The prostate is a very sensitive organ to blood circulation and muscle relaxation. Therefore, stimulating it in the right way can improve microcirculation around the prostate and effectively discharge stagnant secretions. Prostate circulation therapy consists of the following steps. First, it is best to perform it regularly 3 times a week. According to my patient statistics, those who practiced on fixed days, such as Monday, Thursday, and Saturday, saw the best results. Preparing the environment is important. Since increased body temperature promotes blood circulation, it is effective to perform this after a warm half-body bath of about 40 C. If you don't have a bathtub, a warm shower can be a substitute, but it is best to warm the lower body for at least 5 minutes. The most ideal posture is to lie down with your knees slightly bent. This posture relaxes the pelvic muscles and facilitates blood circulation around the prostate. Please use an unscented, non-irritating lubricant. The most crucial aspect is the stimulation method. Most men tend to focus only on the tip of the penis, but for prostate health, it is important to stimulate the base of the penis and the perineum as well. This area is densely populated, with nerves and blood vessels connected to the prostate. The total duration should be about 15 minutes. Start slowly for the first 5 minutes to promote overall blood circulation, and then alternate, stimulating the base of the penis and the perineum for the next 10 minutes. The final step is the ejaculation of semen, which effectively releases prostatic fluid. The prostate circulation therapy I have just described has changed the lives of countless patients. However, I want to emphasize that this is not just anecdotal success, but a scientifically measurable change. In fact, several patients who practiced prostate circulation therapy for 6 months not only experienced significant improvement in their urinary problems, but were also able to resume sexual relations with their wives of 50 years. These changes went beyond mere physical improvements. We observed an overall enhancement in the patient's confidence, vitality, and quality of life. Notably, there was a significant improvement in social relationships. As their urinary problems resolved, they started traveling again, resumed hobbies, and became more socially active. So far, I have explained the direct effects of prostate circulation therapy on prostate health. However, based on my clinical observations, this therapy appears to have a wide-ranging impact on overall health beyond just the prostate. These effects are not mere coincidences, but scientifically explainable physiological phenomena. Firstly, it stabilizes testosterone levels. Many people are unaware that if semen is not ejaculated, for a long period, testosterone levels become unstable, leading to decreased muscle mass, reduced bone density, and lower energy levels. Successful prostate circulation therapy helps restore testosterone levels to a normal range, consequently improving muscle strength and enabling individuals to lift heavier objects. Secondly, it improves the balance of the autonomic nervous system. Sexual stimulation activates the parasympathetic nervous system, which helps alleviate the overactive sympathetic nervous system stress response prevalent in modern individuals. Thirdly, it increases the secretion of neurotransmitters, such as endorphins and oxytocin. These have natural analgesic effects, helping to relieve chronic pain. Fourthly, it strengthens the immune system. Lastly, it positively affects brain health. Sexual activity is known to promote neurogenesis in the hippocampus, which helps maintain memory and cognitive function. Listening to the various effects of prostate circulation therapy I've explained so far, many of you may have questions. If this method is so good, why don't all doctors recommend it? I want to give you an honest answer to this question as an insider in the medical field. There are misunderstandings and prejudices about sexuality and old age in our society. Even within the medical community, there is a widespread misconception that sexual activity naturally decreases and eventually ends as people age. Having worked as a urologist for 40 years, I have realized how far this perception is from scientific fact. Biologically speaking, human sexual ability and desire do not completely disappear until the end of life. Recent studies prove that men in their 80s and 90s, in good health, are capable of sexual activity, and it is actually beneficial for their health. According to a long-term study by Massachusetts General Hospital in the United States, men over 70 who maintained regular sexual activity had a 30% lower incidence of cardiovascular disease compared to those who did not. Their prostate health indicators were also significantly better. The gap between medical facts and social perception causes many men to suffer unnecessary pain. They end up taking prostate medication for life, undergoing expensive surgeries, or, in more severe cases, developing prostate cancer. So far, I have discussed the importance of prostate health management in old age and the effectiveness of prostate circulation therapy. Now, finally, I want to talk about how to apply all this knowledge to your actual life. The most important truth I have realized in my 40 years in the medical field is that health is not something a doctor gives you, but something you create yourself. This principle becomes even more important in old age. In my final research before retirement, patients who consistently followed medical advice lived an average of 7 years longer in good health than those who did not. Prostate health management is more than just resolving urinary problems. It is about respecting and taking responsibility for your own body. And only those who respect themselves can enjoy true health and happiness. Many people give up on their health management thinking, at this age, or now that I'm this old. However, the human body has an amazing ability to recover. Gentlemen, prostate circulation therapy is not just a simple health management method. It is a way to communicate with your body again, and a path to regaining lost vitality. Many hesitate to start because of embarrassment or inconvenience. However, as my patients' experiences prove, the changes brought about by this small practice are significant and life-altering. I sincerely hope that you will put this into practice immediately. After watching this video, try to regain your health through natural methods before relying on medication or surgery. Age is just a number. True aging begins in the mind, not the body. All content provided on this channel is based on the creator's personal opinions and experiences. Health-related information is for reference only, and it is recommended to consult with a professional healthcare provider before making any medical actions or decisions.